Hi folks, Dr. Ed Beyer of Beyer Natural Health Solutions. Today we're going to talk about one of my favorite topics. It's probably the number one condition that I see in my clinic in my 33 years of practicing functional medicine, and that's thyroid dysfunction. And you know, there are actually in the scientific literature 22 ways your thyroid can go wrong. We're going to go through them. I'll try not to make it too boring, but the thing that I want you to remember is that your doctor's not looking at these. So if you're suffering from fatigue and weight gain and hair loss and depression and brain fog and lack of energy, all these things can be remedied. You have other options besides traditional medicine. So you all know that traditional medicine, the way they manage this, they look at TSH and T4 and they adjust your synthroid levothyroxine accordingly. They're not looking at the underlying causes. Functional medicine, we really kind of care about what you have. We want to know why you have it, right? So we're going to go through these 22 patterns. We test for which ones you have. I would say my average patient has about 4 or 5 of them. The number one being the autoimmune variant, which we're going to get into. So why is thyroid hormone so darn important? Well, it controls our genes. It goes in and tells our genes what to do all day long and to make proteins, to make new cells and all of that. So it's just every cell in our body needs thyroid hormone. No other hormone can make that claim. So it's very important. This is it's a hormone that affects everything. One of the things that I see all day long and when my new patients come in, they're like, hey, you know what? I go to my doctor and he says my TSH is normal, my thyroid's normal, and they're so frustrated. Well, I'm going to teach you something right now that's very important that you understand. When you go to the lab and they draw your blood, your doctor gets the results and they're comparing you to a lab range, right? But nobody ever tells you who came up with that lab range. Here's how they do it. They take the average low and the average high of whomever's been in that lab for the last year, and that's the lab range, right? Well, what kind of people go to labs? Sick or healthy? Unhealthy people. So these ranges are based on unhealthy people. We don't do that. We use functional lab values, which are lab values. If you drew the blood of 1,000 healthy people, that's what they would fall into. The other mistake that they do is they don't run enough markers. These are the markers that we run, and up to 9 or 10, depending on your history. And we are going to know by looking at all these markers what the heck's going on in your thyroid. So let's delve right into the 22 patterns of low thyroid function. The first 5 start in the brain. The area of the brain called the hypothalamus and the pituitary gland. It's right about an inch behind my finger. They are the air traffic control towers of all of our hormones, including thyroid. So they secrete what's known as thyroid stimulating hormone to drive the thyroid. There are 5 reasons why this area of the brain will start to shut down. Serotonin deficiency, dopamine deficiency, elevated cytokines, which is inflammation, high prolactin, and high cortisol. All of this will lead to a shutdown of that area of the brain and low TSH, and now you're not stimulating the thyroid gland. And your doctor has not a clue what that's all about. Common causes of these low serotonin, dopamine, inflammation, and all these different reasons: poor blood sugar, poor gut function, genetic mutations, inflammatory diet, food sensitivities, hidden infections, autoimmune, leaky gut, pregnancy can do it, poor progesterone levels or poor estrogen progesterone ratios, prolactin levels. We had to sleuth all this out because I'll tell you, this is a very, very common cause of low thyroid function. So very important that you understand that. Folks, I'm going to be going over a lot of stuff. You're not going to probably get all this. You do have the option of clicking on a link below where I get more into this. Now, other common causes of low serotonin and dopamine and high inflammation, prolactin and cortisol, adrenal dysfunction, anemias, poor sleep. All of these are different reasons why this area of the brain will start to shut down. And guess what? They don't only just control your thyroid, they control ovaries, testes, growth hormone, all these other hormones can be out of balance. All right, so that's the first 5. Number 6 and 7 are antibodies to the enzyme TPO in the thyroid gland or the main protein called TGB in the gland. And that, when your body is attacking that through antibodies, that's an autoimmune disease known as Hashimotos thyroiditis, the number 1 cause of underactive thyroid. Here's a list of the top 15 triggers to Hashimoto's. Again, there's a lot of information there. You can check it out on one of the links attached below. Now, number 8, or first of all, let's go back to that one. What we do from a functional medicine perspective with Hashimoto's is we want to identify what is triggering it and remove it. And those triggers can vary from person to person. All right, number 8, low TPO, which is the enzyme in the gland that produces T4 and T3 due to progesterone deficiency. This is the reason why, when women ovulate, their temperature goes up because it's stimulating the thyroid. People who are trying to get pregnant, they measure their temperature when it goes up. We know that they're ovulating, right? Well, the reason why the temperature goes up because you have excess progesterone at ovulation and it stimulates the thyroid. So we do salivary testing to look at progesterone. One of the reasons, or some of the reasons why your progesterone may be low and creating low thyroid is birth control pills. Folks, there's so many bad consequences to birth control pills. Adrenal fatigue can cause it. Low hypothalamus and pituitary gland, right? And from the brain, and poor blood sugar. Let's move on to number 9. Low TPO, or the enzyme that makes T4, T3, due to certain nutritional deficiencies. Vitamin A, vitamin D, selenium, zinc, protein. These are all needed for that enzyme to work properly. We don't guess. We don't just throw supplements at you. We test to see if you need them. And so that's a really, really common one. And a lot of you are already taking that stuff, but there's more things going on. Number 10 through 15, poor conversion of T4 over to T3. Folks, what comes out of the gland, 90% and above, is T4. T4 is inactive thyroid. It is inactive. And it gets converted over to T3 in the liver, gut, and kidneys and different areas of the body. That conversion of inactive T4 to T3 sometimes is impeded, and it's not happening. You're not making the active form. And there are 5 reasons for this. Nutritional deficiencies, like vitamin A, D, selenium, and zinc. Poor gut flora, that's where it happens, in the gut too. If you're inflamed, T4 doesn't get converted to active T3. If you have high cortisol from stress and adrenal stress, it doesn't get converted over T4 to T3. Serotonin and dopamine deficiencies, very common. T4 will not get converted to T3. Let's move on to and that's a very common. Number 16, you're over-converting. You're making too much T3, and you're like, well, what would be wrong with that, right? Well, here's how hormones work. If they get too high, your cells stop listening to them. That's called hormone desensitization, okay, or hormone resistance. That's very important. Hormones that are too high the symptoms will be just like as if they're too low. It's like if you talk at someone too much. You're talking a lot, but they're not listening, or talking to your teenager, right? So overconversion can do that. So now the causes of having too much T3 is maybe you're taking Armour, maybe you're taking the bioidentical, and you have T3 in it. Maybe not working for you. Elevated testosterone levels due to insulin resistance can lead to this too. And hormone resistance, too much of a hormone can also lead to certain hormones like progesterone and estrogen can lead to that too. Number 17, you have too many binding globulins. When a hormone is made, when the thyroid hormone comes out of the thyroid, it doesn't just float around freely. It attaches to a protein called a thyroid binding globulin. I call it a taxicab. And if you have too many of those taxicabs, now you don't have enough, and it's all captured on the taxicab, you don't have enough free fraction of the T3, and that's measured on the blood by a marker known as T3 uptake. So the main cause of that is taking hormone replacement like Premarin, birth control pills, low progesterone, constipation, and poor liver function. So we have to measure total T3 and free fraction T3. Number 18, so we're making our way through all this. And folks, you don't have to remember all this, just remember your doctor's not checking for it, okay? Low thyroid binding globulin, where you have too little taxicabs causing too much T3, and then we're into that thyroid resistance pattern again. This happens with people that are diabetic or have high blood sugar, or men that are on testosterone replacement therapy. Okay, number 19, 20, 21, and 22, the last 4. I see this all the time. It's called thyroid resistance. It's where the thyroid hormone cannot get into the cell to work the genes, right? It's got to get into the cell. You could, like, for example, you could have all the money in the world, but if you can't get into the store, you can't spend it, right? So number 19, elevated cytokines. Cytokines are messengers of inflammation. So if you're inflamed for whatever reason, that can prevent thyroid hormone from getting in. High cortisol from the adrenal glands will prevent T3 from getting into your cells and working their magic. Deficiencies in vitamin A can do it, and elevated homocysteine, which is a marker that we look at all the time in the blood work, can also prevent thyroid hormone from getting in. So we look at a marker called T3 uptake on your blood panel to see if you have this. If you've enjoyed what you've learned today, it's been a pleasure. Don't forget to subscribe for more upcoming videos on thyroid dysfunction. Also, please, 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 if you know someone that has a thyroid problem and is suffering, like and share so they can get this great content. I'm Dr. Ed Beyer of Beyer Natural Health Solutions. Have a great day.